Thanks again for having us here, and thanks to Steve and also to Dr. Cunningham for arranging it. And make sure I can get my slides here. So I know what you're thinking. The first thing you're probably thinking is, oh my God, someone is going to talk about concussion legislation. This is the most boring thing ever, which hopefully is not true. And probably the second thing you're thinking is, why is a doctor talking about the law? So I'm a pediatrician, as Steve mentioned, and as a pediatrician, the biggest thing that we are concerned about in terms of morbidity and mortality with kids is injury. And so I've sort of dedicated my research career to working to prevent injury. And one of the tools that we have to prevent injury is the law. We don't have a microphone, apparently. And so we have been trying to understand how to better prevent injury, how to make behavior change. The law is one of those tools that we have. And we've been able to use this, you've seen before, with seatbelts, with smoking, all of these types of legislation make a huge impact on behavior. And for those of you who were around during the 80s and rode around in those station wagons in the back, sliding around, they know that seatbelt laws really made a huge difference. You know, that for the longest time, there's lots of people going around trying to do educational campaigns about seatbelts and saying you should wear seatbelts and doing studies and qualitative studies and how do we get people to wear seatbelts. And finally they said, we just charge them $150 if they're not wearing them. And all of a sudden, magically, everybody's wearing seatbelts. And so that's really what brought around concussion legislation is how can we make a change? Okay. So this is really, I'm going to start out talking a little bit about the history of concussion laws and really what they are, describe what they are. And then look, there's a little bit of data at the impact. This is still pretty new because these laws are fairly new. And then where do we go from here? So as Steve mentioned, I come from Seattle, Washington, or I live in Seattle, Washington, and so I have the privilege of working pretty closely with Stan Herring, who's sort of hiding in the back there. If any of you know Stan, he's kind of a personality, so he's not usually hiding in the back. And Stan he was sort of the force of nature that got this concussion law passed, the first concussion law in Washington State, which was the Zachary-Leichstadt law. And Stan's a rehab medicine doc. He's one of the team docs for the Seattle Seahawks, one of the team docs for the Seattle Mariners. And so he's worked a lot with injured athletes, and he felt very strongly that we needed to do better. He was seeing these athletes with brain injuries, and people weren't taking him seriously. He felt like he's pounding the pavement, talking to coaches, and trying to say, these athletes shouldn't be going back in the game if they're injured, and it wasn't happening. And so he partnered with Richard Adler, who is a lawyer, and he also partnered with the head of the Washington Interscholastic Athletic Association, the head of Washington Youth Soccer, and with a family that you see here, so Zachary Leichstadt. Zachary Leichstadt was a middle school football player at Tahoma Middle School, and he's playing in the first half of a game, and he gets hit, and he comes out of the game. They say, oh, it's probably just a ding, sit out for a little while, you'll be fine. So second half, he goes back in, and he gets another hit, and he collapses. And he's airlifted to Harborview Medical Center, which is our level 1 trauma center, and he has a subdural hematoma. And as you see here, he was on life support for a week. He didn't talk for 9 months. Many years of rehabilitation. So clearly, Zach Leichstadt did not have a concussion. He had a severe brain injury. But Stan's concern, and I think it's a real concern, is that they knew he had a brain injury and they put him back in, and that shouldn't happen. And that shouldn't happen to a 13-year-old kid. This is not someone who's getting paid millions of dollars to play football. Like, why does he need to be in the game? And so that's really the point of these laws was we need to stop athletes from playing when they're symptomatic. So this is the law was passed in April 2009. I think what just you see here is it was passed unanimously. We're very quick to pass laws when they're about youth, when they don't affect us. I think it's been harder to pass seatbelt laws. There's money involved. It's harder to pass helmet laws because people don't want to wear helmets. But these laws actually were not as hard of a sell. The law is sort of very simple. It says if you think someone has a concussion, you have to pull them out at youth. And then they have to get written clearance from a healthcare provider before they go back. And then there needs to be some education. The Washington law actually doesn't really specify the education very well in the law. It says that parents and youth have to sign a concussion form. which I've talked to lots of youth who sort of say, I'm signing my life away, which interestingly is not entirely untrue because our law actually provides some litigation protection. So Zach Leishtedt and his family won a $14.6 million lawsuit against the Tahoma High School. The interesting thing about all of this is that that provides a huge amount of incentive to schools to follow these guidelines. And so I think that is actually a powerful part of the law. So the strengths of the Lies Chat law, one, to me, I think the litigation protection is a strength, but I think that could be argued. There's other ways to think about that. It was also, this partnership with the WIAA, the Interscholastic Athletic Association, is very important because that provides a lot of buy-in for high schools because that's who they work with when they're competing, and they really set the guidelines in the same way that the NCAA sets the guidelines for collegiate athletics. And our law allows athletic trainers to clear athletes, which I think is incredibly important because athletic trainers, they know those athletes the best and they know a lot about concussion. I think one of the limitations of our law, and this has been true sort of across the board, is that it's not always true about all the other healthcare providers, physicians included. And so, I'm very interested in concussion. I'm a pediatrician, but a lot of pediatricians really specialize in 1 to 5-year-olds because that's who gets vaccinations. And so trying to keep up with what's going on in concussion may not be as much of a priority. And so trying to make sure that they really have that knowledge it's not contained in the law. It also doesn't have a lot of sort of stipulation for education. It's pretty limited in that manner. And part of that was that it's hard to get that passed to say parents have to do all of these more detailed things. That would have been a harder sell. It's not specifically applied to private schools, to club sports, which, as we know, is a huge part of where kids are playing sports. The reality is with our law, because it provides this litigation protection, a lot of those organizations actually were following these guidelines with hopes of getting some litigation protection themselves. And then the biggest thing is this is secondary prevention. I mean, really, we would love to be preventing athletes from getting concussion, not from preventing catastrophic injury if they have a concussion already. But, it's a start. You start where you are. So this is just to show you, and you've seen this from Dr. Guskowitz's slides earlier today, but that very quickly this kind of rolled out across the country. And this is not random. Partly Stan, as I said, is sort of a force of nature. And Stan would talk this up, and he's working with the NFL, and he said, we've got to get these laws in all 50 states. And by 2014, we had laws in all 51 states, count DC. This is to show you, there was actually, for a while, there's this interactive maps that you could look to see where there were laws. And so this is in 2013. And so the last holdouts, not unsurprisingly, were some of the southern states and Montana. It was sort of, they probably just barely passed seatbelt laws in a lot of these states, so that this not surprising. But I think that's actually impressive that we've been able to pass laws in all the 50 states, and we actually don't have motorcycle helmet laws in most states. And it was, so I think in Michigan we do for under 18, but not for adults, because and there's, a lot of pushback with those kinds of things. This is to show just that there's even been some amendments to those laws. People have been trying to make these laws better. So there's been a couple studies looking at the variation in the laws. We have 50 laws now. Are they different? And do those differences matter? What is the strength of the law? Most of the laws, truthfully, still don't have mics, are pretty similar. There is some variation in terms of the amount of education that they require, the specific education. One law, like the Arizona law, which you might hear a little bit more about when Tamara talks after me, they actually have their own educational sort of a program that they developed called the Brain Book. And then there's some that actually have different removal from play criteria. So some say you have to have actually passed out. You have to have a loss of consciousness, which as we know, is a small percentage of kids with concussion. Our law and a lot of the other laws are much more stringent than if you just suspect an athlete has concussion, they have to be pulled. The healthcare practitioner standards vary, so who can clear an athlete? As I talked about, ours includes athletic trainers. Many do not. Some say only physicians. Some say a chiropractor. So this has sort of became a big lobbying thing because, of course, it ends up being a moneymaker in terms of if only physicians can clear, all of a sudden physicians are getting a lot more business from this. liability protection, as I talked about, is not included in all states. I think that's about a third of them have liability protection. And then I think this is really interesting is that sort of new measures have been added. So these laws really were sort of designed around high school protection, interestingly, not necessarily college, and not much younger. So they have been applied sort of to middle school age groups, but there's often not an athletic trainer there, so it's less rigorous, and there's really not applied to elementary school. And there are now some schools or some states that are trying to think about expanding these laws, and there's now been some mandated graduated return to play. There's some that have talked about having a return to learn as part of the legislation. And I think really interestingly, California just passed a limit on full contact practice, which is really extending the reach of these laws, because these laws have been described as return to play laws, but really, when you start limiting full contact practice, that is primary prevention, and that's a really whole other way that legislation could be used. So the real question is, do these laws work? And you say, well, what does that even mean? What would work look like? And I think the first question is, does anybody actually follow the law? Because we can write a lot of laws, but as I said, no one's getting punished for these laws, and the only incentive is really this liability protection. I think after that, you say, well, if people are following the laws, are we seeing more concussions? Are we getting more concussions diagnosed? Is there more healthcare utilization for concussion? And then the final thing is, are the laws having the impact that we really hoped initially, which is, do they keep athletes from playing with concussive symptoms? And I think that's the hardest thing to measure, and we'll talk a little bit about that. But first we have this diagnosis that has no gold standard, and so how do you even know someone had a concussion? And then we're trying to measure, athletes self-report, and then you think about, when do we care that they were playing with symptoms? Do we care the day of the game? Do we care the next day? Do we care that it was a week after their concussion and then they went back too soon? And those are all different things. So this is just to say that we know that laws work to improve health. I mean, there's amazing data about smoking laws. Smoking laws actually change you can actually measure that there's less pollution in the air when there's laws that are passed about smoking. The seatbelt laws, there's decreased morbidity and mortality. These have all been proven again and again. Bicycle helmet laws, despite every now and then you get those Facebook memes that say bicycle helmets don't work, that's a lie. Bicycle helmets are incredibly protective. And child car seats, again and again, we know that this approach to public health safety does work. So this was the goal, as I said, of the Leichhardt law, was we want to prevent youth from playing with concussive symptoms. So this is a study we did a few years ago where we wanted to see, are people following the law? So, as I was saying, the sort of first thing is, do people even do this? So we took a random sample of high schools that had football and soccer, and we sampled the football and soccer coaches, and we said, what kinds of educations are you getting? What kinds of education do you give to the athletes that you work with? And we said, where do you get these educational materials? When we went into this, we were like, who knows? Maybe they just look up online and they write something themselves about concussion, or maybe they're using the CDC's heads up materials. Interestingly, we found that the reality is most people are pretty lazy. So they're required to do this guideline. They were following the guideline, but they just go to the WIA website and they see what's there and they pull it down, what is there is written by Stan the night before. Basically, he was like, oh, wait, I've got to come up with some concussion education materials, because he'd sort of forgot about that part of it. And so which is good, at least, that they're using this standardized information, but I think the downside is that education is pretty limited. All this study, we were expecting to find more variation in implementation, that then maybe we could look at how that would affect concussion reporting, but then there actually wasn't much variation. We'll talk about that, and there's another study. So this is just trying to say, okay, so do we see increased diagnosis, and do we see increased healthcare utilization? And the first of these studies, was a really tiny study that was done in Washington State, and most of these are really relying on natural history. And as anyone who's an epidemiologist knows, you have to be really careful when you do natural history studies, because any before-after study, you have to think about all of the things that are going on in that time period, not just the law. But so the first study, they did find an increase in concussions, but it happens to be that they also had just started working working in the schools the year before that law. And if you really look at their data, they actually had no soccer concussions diagnosed the year before, and then had, 5 the next year and 9 the next year, which you think, well, people probably figured out that there's an athletic trainer over there and that they could go over. And, the athletic trainer's on the side of the football game, not at the soccer game. So it's hard to know whether that's really from that. But they were legitimately seeing more concussions the next 2 years after the law was passed. The McKenzie data, they were looking at emergency room data, and there's sort of been this question about, are we seeing more concussions in the ER? And they did a more sophisticated analysis of trying to look at, this is healthcare utilization data, so ICD-9 codes, and using E codes for sports to try to see whether there were increased concussions being seen in the ER. And they had a twice the incidence of concussions being seen in the ER after the law. It was interesting because they tried to sort of control for other injuries that were coming in and control for ankle sprain, but they then don't report relative risk. So there's sort of some question about that. But I think the most interesting study is Teresa Gibson's study. She's an epidemiologist who's at Harvard, and she did this study with Steve Broglio, who's here today. And they looked at national healthcare insurance data and found that there's a 92% increase in healthcare utilization for concussions following the passage of these laws. But interesting, also a 75% increase in states without the laws. And so I wanted to show some of their data in more detail because I think it's really fascinating so you see from 2005, the concussion rate had been sort of fairly stable from 2005 to 2008. And this is really per 1,000 enrollees. So just to remember, this is healthcare utilization. So it's only people who have insurance, which, with Obamacare now should be everybody, but back in that day was not. So there's some bias within that. But otherwise, it's very interesting data because then you see all of a sudden the rates have started jumping from 2009 to 2012. The interesting thing is that they also looked at this data in more detail, and in a sort of a counterpoint to McKenzie's study, they actually don't find that there's increased rates in the emergency room, but that these patients are being seen by neurologists, by outpatient physicians. And nicely that there's not increased CT scans, there's not increased inpatient admissions. The ones that they're picking up are the more, the ones that can be seen in an outpatient clinic. And I thought this graph is just really nicely illustrates it, which is, you see as the line is, fairly stable from 2005 to 2009, and then you start to see these jumps in 2010 to 2013, and the orange lines are the states with legislation, but the black line is the states without legislation, and that slope is increasing. And there's many things that are going on during this time period, so there's definitely legislation, but one of the things that's fascinating is, I started to have a Google alert for concussion in 2009 because I was like, God, there's all this stuff going on. I've got to really try to make sure that I don't miss anything that's happening because, otherwise you're at a party and someone's like, did you see that article about concussion? And you've missed it. And with the concussion legislation, this was a huge boom for Google, that all of a sudden there would be, every time you've got to pass a law, you have to get a groundswell of support. And so you have to write lots of articles about it. And so there's all of this media about concussion. And this is, of course, then at the same time that gets like parents fired up, and then they start writing their own things, and there's the moms' blogs. And then at the same time, you have the parallel things that are going on in the NCAA and the NFL. And all of this is also causing this groundswell of support for research. And so all of that is happening at the same time. And so trying to say that this is just due to legislation is clearly not true. But I think it's a part of that. It's a part of what's happening. So this is the sort of, few studies that have tried to look at the impact of legislation on concussion symptom reporting. And as I said, this is a really complicated thing to look at. And there's really, because you get into this question of, well, so you can ask the kid, do they report their symptoms? But then, what do you do with a kid, for example, who just passed out? Who had a loss of consciousness? Well, he didn't have to report his symptoms, right? Someone saw he had a loss of consciousness, and so how do you include him? And that situation actually comes up a lot. If there's an athletic trainer, the athletic trainer might have then gone up to the athlete, and so it's complicated. And so we've, I think our study is the top one there. And, as I said, we were initially hoping to look at variation in implementation and how that affected concussion reporting, but there wasn't enough variation. But what we did find is that there were a lot of kids still playing with symptoms. And so this is not a before-after study. That was just an after study. And that's 778 athletes, but 83 concussions. And so 70% of them said, yeah, I still play with symptoms. And most of that is like in that game. And a lot of this goes back to, what Grant was talking about in his talk is like, you get concussed, but you have a part of the game where you're sort of like, am I okay? And that's it's realistic because there's a lot of times when you're playing sports where you do crash into someone and you have to have that moment of, wait, am I okay? And so it's hard to know whether that's meaningful. John O'Kane is another sports medicine doc who works in Seattle, and he worked with Melissa Schiff, who's an epidemiologist, and they had a big epidemiology study of middle school female soccer that just happened to be going on during this time period. And so they decided to look at some of their data because they had sort of this advantage of natural history. They had some kids that had started in their study the year before the law, and then they had the kids after. The reality is because concussion is rare in middle school soccer, they only had 11 concussions before and 48 after. And so it's hard to really make that much of that data. They did find they actually have really nice athletic exposure data as denominator data where they were actually tracking kids coming in and out of the game. And there was no difference in incidence rate of concussion after the law. They also looked to see who saw providers, and that wasn't different. They did find that the ones after the law were more likely to get diagnosed with a concussion if they saw a provider, but the numbers start getting small when you get to look at that because you're starting out with an N of 11. But one thing that's interesting is that 70% of those before the law said they reported that they played with symptoms, and after the law, it was 56%. It's not significant, clearly, and clearly 56% is still a high number, but it was just interesting that they did try to report that. And they were directly contacting athletes. So they had an email, a system where they would find out if an athlete was injured. And then if they were injured, then they would call them and do an interview with the parent and with the child. This is a more recent study, La Roche, which is also with Dr. McRae, who's here. And they had another natural history study. So they had a 1999 to 2002 survey of high school football players where they asked them, have you ever had a concussion? Did you have a concussion this past season? And if you had a concussion, did you tell anybody about it? So, really simple. It's like a sort of 1 to 2 page survey. And before, they had this 1999 to 2002 data on about 1,500 athletes. And then they repeated that in 2013 after the law in Wisconsin with 200 athletes. And they found that there were more people reporting after the law was passed. So this is, just to remember, it's sort of an inverse of what we were talking about before. As opposed to people playing with symptoms, this is kids that are reporting. It's not entirely an inverse, which we'll talk a little bit about, but that they had 70% were reporting after versus 47% before. So this is just to say that I think, we use law. Law is just a tool. And we think of law as only mattering if you enforce it. And so, that we have lots of cell phone laws, but there's certainly lots of people on the road using cell phones. You just drive in your car, and you're half the time seeing people's eyelids as opposed to they're actually on the road. And that's true initially. And so, that you may not really slow down in the school district when you're supposed to slow down to 20 until you get that $150 ticket, and then you slow down. But the truth is, I think this is really interesting because what they say here is that that's true initially, but eventually laws actually can cause attitude change. And one of the things that I think about is the whole seatbelt thing. When I was little, I did drive around in the back of the station wagon without a seatbelt on. But it has now come to the place with seatbelts that someone gets in your car and they don't put on the seatbelt. And you say, what's wrong with you? Put on your seatbelt. I'm not driving with you in my car without a seatbelt because I'm not going to be responsible. It's almost become this ethical thing. It's a really different level. And that can really be the power of law, is that you can actually change culture with law. It's a different way of thinking about that. And on that note, I wanted to talk a little bit about, so I as a pediatrician, I work with a lot of people who do behavior change. So I work partly at the Center for Child Health, Behavior, and Development, where we have people who work on obesity, people who work on substance abuse. And when you work on behavior change, we end up coming up with lots of different models because it's very hard to do behavior change. And so you try to understand more what's causing behavior and how can I intervene in those different areas of what's causing behavior. So public policy, this is one model, this is a social ecological model. And when public policy is really the outermost influence, the sphere of that, but then there's also community, sort of cultural values, there's organizational, the environment, like the NCAA, there's the interpersonal, like teammates, the social network, and there's the individual knowledge, attitude, and skills. And ideally, we can think about interventions on all of these levels. So this is the theory of planned behavior, which is another model of thinking about behavior change. And that this is a kind of model that was used for things like smoking, things for getting people to lose weight, that really someone does a behavior because they have the intention to do the behavior, and there's things that predict that behavioral intention, which is what do they think is going to happen if they do that behavior? What are their friends doing? Like, what are the norms for that behavior? Do they think they can do it? So do I think I can quit smoking? And this is, we then, in a study a couple years ago, decided to say, well, can we think about concussion symptom reporting behavior using the theory of planned behavior? And there's now a whole literature around this, thanks to many colleagues. So Emily Crocius and Joanna Register-Malik have been doing a lot of work in this area, and I think trying to understand where are the places we can intervene, how can we use this to our advantage to better have kids report symptoms, because the laws are only going to work if we can really think about a way to make education better, to make that education actually help kids report symptoms. So I'm an adolescent medicine doc, and I always think about, smoking. And so, we say, oh, yeah, well, if we just tell kids that concussion is bad for you, then they're going to tell us about their symptoms. And I say, that didn't work for smoking. We know that smoking kills you, but if you go up to a teenager and you say, you shouldn't smoke, it's going to kill you, they'll laugh at you and light up in front of you. And that in the end, actually what works for smoking is that you tell them, it makes your skin really bad, and then it makes your breath smell, and nobody wants to kiss you. And they're like, oh, I don't want a cigarette anymore. So that really, I think that's the kind of mindset that we have to bring to concussion is, if you get a concussion and you play, you may play badly, and you may let your whole team down, and your whole team is going to be mad at you. And that's the kind of thing that actually a kid thinks about. Those are the kinds of risks that are more meaningful. And so that we're now starting to think about models that think about this as a risk behavior. And so playing with concussive symptoms, really, if that's a risk behavior, it's not something you intended to do any more than someone would intend to have unprotected sex. That's a risk behavior. That's a risk that they were willing to take. And this is a sort of a newer model. It's called the prototype willingness model, which is thinking about, as opposed to intention to do behavior, it's the willingness to take on a risk. And so we have some new studies looking at this area. And I think my hope is that the legislation can, as I said, law is just a tool, but that we can help make that tool better. And so we can help have better educational programs and to think about what are the things that are really going to change behavior. And it may be that what we need to do is have an athletic trainer on the sideline, but those are the things that we can use law to help us be a tool to do. And I just wanted to thank, I'm privileged to work with a lot of very talented, very smart people. Fred Rivar is sort of one of the mentors that I've worked with the most, who's done a lot of work in brain injury over the years, particularly around helmets and around youth injury, and lots of other support people, and privileged to work in Seattle.